Hello.
Hello.
I'm Mahan. I'm one of the treating physicians here in the department. Are you Jenny Thompson?
Yes, Doctor, I'm Jenny.
Can you please confirm your age?
And yes, Doctor, I'm 50 years old.
Okay, nice to meet you, Jenny.
Thank you. Nice to meet you too, Doctor.
So I think from my notes that you have been scheduled for the night test removal, right?
Yes, Doctor, that's right.
Okay, so how are you doing now?
Actually, Doctor, I still have some symptoms which annoys me, but the doctor told me that these symptoms will disappear after the operation.
Mm-hmm.
Actually, I feel so worried about this operation. I don't know anything about it. It will happen. Yeah, I'm so worried actually.
I can see how you've worried about the surgery, and I know anyone at your place would feel the same because surgeries are not
Mm.
something like we do usually every day.
Yes,
So
yes,
yeah, okay. So I'll answer everything. Any questions that you might have about surgery in a couple of minutes, please.
yes, okay, that's okay.
Okay. So as for now, I'd like to know if you're having any tummy pain.
No, doctor.
Okay. I'd like to ask you a few questions about your general health, please.
Yes, that's okay.
Okay. About your period, do you have regular periods?
Actually, I used to have regular periods, but recently I don't have regular periods at all.
Mm-hmm.
It comes and goes. Sometimes I miss 2 or 3 months, and then it comes again.
Mm-hmm.
Yeah, that's
Okay.
it.
Yeah, okay. Are you taking any contraceptive methods?
No, doctor.
Okay. Is there any chance that you might be pregnant?
No,
And, okay. Do you have any medical condition I should be aware of?
no, doctor.
Are you taking any medications for any reason?
No,
Do you have any allergies?
no, doctor. No.
Okay, perfect. Would you please walk me through your habits? I want to know if you're smoking.
No, doctor. I don't smoke.
Do you drink alcohol?
No, just occasionally.
Okay. Jenny, I want to make sure that you will be supported after surgery. I'd like to ask you, who is going to take care of you?
Yes, doctor, I live with my husband, and he is supportive, and yeah, he will take care of me after the operation. But doctor, will I be so tired after the operation?
Okay, I can see how you're concerned about this. This question will be answered in a couple of minutes.
Okay.
Okay. But first, I'd like to tell you that actually I'm happy to hear that your husband will be there for you. Thanks so much for answering my questions so far. Now I'd like to ask you if you have been told anything about this operation.
No, doctor. The doctor told me that I will have an operation called the system movement, but he didn't tell me anything.
Okay. As you see here, I'll explain everything to you. As you see here, this is what we call the bikini line. This is the surgeon would make an incision in this part, the bikini
Mm-hmm.
line, and then an instrument, it's called laparoscope, will be inserted. You have the rhinocyst, which is assessed through the fluid and other odd material. Actually, the cyst you're having is quite big. It's 8 centimeters times 8 centimeters. So the doctor will try to get through this opening until he reaches your left ovary, and then he will take this cyst out, and he will stitch this place with absorbable stitches. So there is no need to remove the stitches after the operation.
Doctor,
Yeah.
by any does this will affect my ability to have a baby in the future?
Yeah, I can see how you're worried about having a baby. Actually, as you know, this list is quite big. So the surgeon will do his best to to preserve your ovary. But if he couldn't do this, he will remove the ovary also. But no need to worry about this. You will be pregnant at any time as long as you have a functioning ovary.
Yes, doctor, actually that's worrying, but
Yes.
yes. Doctor, what type of symptoms that are relatable after this operation?
Actually, this kind of operations, usually may experience some abdominal pain, but we will manage this by giving you painkillers after the operation. Sometimes you will feel like your abdomen is bloated, but any symptoms that you might have, it will be managed.
Yes. So, doctor, when I can return to my work and to my normal life,
Yeah.
yeah, when I can have sex.
Okay, so and it's you can return to your normal life. Usually, this process of recovery.
Screening.
Okay, so usually this kind of procedures, the recovery takes like 4 to 6 weeks. So you're expected to resume your normal life after this period.
Yes, yes, doctor, that's good. So, doctor, is there any chance that I would develop another cyst after the operation?
Actually, this is a very good question, and yeah, there is a chance. Some people after removal of the cyst they have another cyst, but some people do not develop other cysts.
So, what can, it depends on which doctor.
Actually, it depends on the person himself. There is no there is no factors. Sometimes it happens, sometimes it doesn't happen.
Okay. Yeah.
Yeah, okay. So I do want to know about the complications that might happen.
Yes, please.
Okay. Usually this is a phase operation, but it's like any other operation. It has its own complications, like bleeding maybe. So we manage this by blood transfusion. And by the way, do you have any restrictions to blood transfusion?
No, doctor.
Okay. So the other one is infection, and if this happens, we will manage this by giving antibiotic. And the other one is called a DVT. It's like a development of a clot in the legs, and we manage this by encouraging early mobility, and sometimes we give blood thinner to prevent this from happening. And the other one is like damage to surrounding systems. Okay.
This is beneficial.
Hi, Dr. Nurhan. Thank you so much for participating in our group. So basically, the positive points for today were, first of all, you greeted the patient in a very nice way. You double-checked her date of birth, which is absolutely perfect. You were really empathetic with her, okay? You assessed her understanding about the operation, which is perfect and very important because basically you need to know what the patient already knows about the operation, and then either you can add on anything that the patient hasn't mentioned to yourself, or you can rectify anything that you think is actually not right. Okay. Also, a very positive thing was when you explained to the patient about the operation using a pen and paper, right? All of these were really good in the station. So things to keep an eye on, and things actually that might need some sort of improvement whenever you're actually taking any history from a patient who has already been seen anyway beforehand, and she's already been seen by a doctor before who mentioned that she's going to be having an operation soon. So you don't have to take a detailed history. So he didn't actually take a detailed history, but asking about the last menstrual period, asking about our periods really regular, for example, wouldn't make any difference to the operation itself. So the most important question you asked here was actually about pregnancy, because a patient who's suspected to be pregnant cannot go for an operation. Another thing I noticed when you asked about, or when the patient mentioned to yourself that she's concerned about tiredness, she said, "Doctor, would I be tired after the operation?" You mentioned you're going to get back to her in a minute, however you didn't. So very important, whenever you are promising the patient about one thing, you need to get back to it as soon as possible. You need to let her know or to address her concern, because if you don't do that, you will end up by not addressing her concern. So very important. And she asked you whether she'd be tired, so you can still dig further into that. So why do you think so? Any specific reason why you're concerned about tiredness? Okay. Again, when you mentioned you will be pregnant at any point of time, so that's partially correct, because basically she's still can be pregnant, but never promise the patient that she can and she will be pregnant at any point after having an operation. So you can say, okay, so that's an operation, however, you can still be pregnant at some point. Again, when you asked the patient about would you like to hear about the complications, so that was really a good thing. Please do not bombard the patient by telling her, okay, so the complication might be infection, bleeding, and whatsoever. Okay, so you did really well when it comes to that point. You also mentioned about complications will be manageable. Okay, so they can be manageable, not will be manageable, because probably you might not be able to treat bleeding, for example, if that happened. You can still do that, but again, not in every single patient. Okay, so very important to keep an eye on what you tell the patient about, and again, do not promise the patient that things might happen or might not. Okay, so always say it's most likely that you're not going to have this complication, for example. Okay. Again, you enter the station without safety netting. I understand that time management was one of the main issues today, but again, I think probably if you omit some stuff such as like asking about irrelevant part in history, that might actually help you getting some few seconds to speak about the safety netting, for example. Okay, so first things first, the most important things need to be mentioned first. Safety netting is a very important thing. You please try to do that as soon as possible in your management plan, otherwise your station will end without mentioning anything about safety netting. So again, very important not to omit that. Overall, it was a very good consultation. Thanks so much, Dr. Nurhan, and good luck with your exam.